Hello guys, welcome to my VSG series. For those who don't know, I'm Dr. Mo and I did a stomach surgery, aka a bariatric surgery, almost 11 months ago here in Jamaica. And this series, I just want to share my experience. So I have compiled all your questions into several parts and will be answering to the best of my ability, my knowledge, and obviously my experience. So this part one video will cover what is stomach slash bariatric surgery, the different types, the difference from a cosmetic surgery, why I decided to do a VSG, what is it, how it works, how much it costs, and my updates since I've done it. So the first question was, what is a stomach or bariatric surgery? So basically it is a surgical procedure used to manage obesity or obesity related conditions, which in return help you to lose like a lot of weight. And you know, obesity means being overweight, and then you have different levels. You have moderate obesity, severe obesity, and then I think you have super severe or very, very severe obesity. And then I think this obesity is basically categorized by your height and then how much you weigh. So for your height, you're supposed to be in a category in terms of how much you should weigh, and if you're outside of that, then that would be considered obese. So it basically works in terms of the surgery by changing the anatomy and the size of your stomach to limit the amount of food that you can take in. And in some cases, they alter your digestion process to improve your fat metabolism. Another question was, what is the difference between stomach slash bariatric surgery and cosmetic surgery? Because I've had a lot of persons who thought that I did a cosmetic surgery, and I keep trying to explain that there's a difference between the two. But a bariatric surgery is basically done primarily for weight loss and to improve your quality of life, while on the other hand, a cosmetic surgery is done to improve your appearance. It is done to improve the aesthetics, your proportion, that maybe you want bigger boobs, or you want smaller boobs, or you want a flatter stomach, you want a bigger thigh, you want a bigger hip, or you want a small waist and a bigger booty. So that is what it is really. So cosmetic surgery can be done for any reason, not just weight loss, but bariatric surgery is done basically for weight loss and for the improving of your quality of life. So what are the different types of stomach slash bariatric surgery? You have the gastric sleeve gastrectomy or the vertical sleeve gastrectomy, which is the VSG. You have the gastric bypass, and I will explain what the gastric sleeve is. But the gastric bypass, this type of surgery also makes your stomach smaller, and it basically makes it bypass part of your small intestine, so the food is digested in a different pathway. The end result of this surgery is that it makes you feel more full more quickly, which reduces the amount of food that you can eat. However, this surgery is reversible. Then you have the gastric banding. In this surgery, a band is placed around your stomach, which limits the amount of food that you can eat and allows you to also feel more full. And one of the benefits of this surgery is that it is adjustable and is also reversible. So what is a VSG? Now, the gastric sleeve or the vertical sleeve gastrectomy, which is what I did, this surgery removes a part of your stomach that is responsible for sending hunger cues, and when it is removed, it lessens your appetite and it allows you to lose a lot of weight. Now, in this surgery, the size of your stomach is drastically reduced, and this surgery is non-reversible. And this also means that you are unable to eat as much as you used to, and this can be for years. Now, why did I select the VSG? I needed a permanent option as I struggled with hormone imbalance, aka PCOS, and I needed a jump start towards a healthier journey and just a second chance of living life in a healthier way. Also, I didn't think I had a choice based on the fact that my starting weight was 283, so I was, I think, moderately obese. For my height, I'm 5'5", and I weighed 283 at my start weight, and I was at risk because my BMI was very, very high. And when I went in to do my consultation, this was the only option that was provided to me. And I did do a consultation in 2019, and at that time I think the gastric bypass was recommended to me. But this time when I went in December 2022, the only option that was given to me was the gastric sleeve. Now, how does a VSG works in terms of the cost, the recovery, and all that good stuff? For example, most surgeons remove 70% of your stomach. However, for me, a little more was taken out, so I basically have the stomach of a baby, and most babies eat more than me in one sitting. Now, for the surgery cost, I will break it into two categories. So you have the pre-op procedures, and then you have the actual surgery. So for the pre-op procedures, I spent around 100,000 Jamaican dollars. That covered paying for consultations and follow-up visit fees, also for the specialists, and then also covered for the lab test that I had to get done, the lab work, the lab test, and general test that I had to do. And this is with insurance. And I think in part 2 I will discuss each pre-op procedure that I had to do, and basically how much each consultation cost, what was discussed in each consultation, and what you can expect if you're thinking of doing a stomach surgery here in Jamaica. Now, for the actual surgery cost like 1.6 million Jamaican dollars. My insurance covered most of it, so I think I ended up paying like $600,000 for the surgery and the hospital fees. Now, the actual surgery took like 1 hour. I actually spent one night in the hospital, and I stayed at Art of Surgery. That's a hospital I didn't know about before doing this surgery. The normal recovery time is 2 weeks. However, my recovery didn't really go as planned, as it took months for me to recover because I had like really bad acid reflux, and then my stomach was just super sensitive and I wasn't keeping down anything. Now, for the update, my start weight was, as I mentioned, 283. To date, I've lost over 130 pounds so far. I moved from a 4X to a medium or small depending on the material, which basically means I change the wardrobe every month. For gym, I started gym at month 5, having fainted at months 3 and 4. I do have a personal trainer. I will tag him. It's Shamar_fitness, and I do go to the gym 4 days a week, and I mainly or mostly, if not all the time, just do weights training. For food, I have been assigned to a nutritionist. It's been kind of rough. Mentally, it's very taxing because I can't eat what I want, and even if I can, it's just a tiny proportion. Also, I will throw up if I overeat, or if I eat something that has skin, or if it's too oily or has too many seasonings on it, or if my stomach doesn't want it. I mostly eat protein, fruits, no vegetables, no bread, no rice, and just a small amount of sugar. And I try to drink enough water because I do get dehydrated a lot. I do drink a lot of soups, and that's like my main go-to meal these days, especially when I'm coming on the road. And the thing is, because my stomach is so tiny, I have to choose between eating and drinking. So majority of the time I'm dehydrated because I want to eat, but I'm working on that now. I think I would have to go into part 1B just to finish explaining everything.